Hello, I'm Jeong Wook from Sketch Plastic Surgery. As it says in the name, it is a surgery to improve the shape of the eyelid. People usually undergo this surgery to improve the sagging eyelid. To do this, there are two ways. One is to remove the skin or making double eyelids to folding up the sagging skin. Removing the right amount of skin and folding up the right amount of skin requires personal experience. Also, people who have trouble opening their eyes, which covers the pupil therefore causes sleep eyes, can be modified as well. It is also called ptosis or ptosis correction. The biggest reason of sagging is as people age, the upper eyelid skins are aged and it droops down. Eyelid skins are the thinnest skins from our body. Therefore, it is most vulnerable and easily stretched. Drooping skin blocks the sight of the eye, also causes skin erosion. Eyelids can droop down without the skin stretching. Other causes is weakening muscles for eyes to open. Muscles that help eyes to open wide is actually far from the eyelid. In between, it is connected with thin membranes. Muscle strength can be weakened. Part of the thin membrane can be partly modified or snapped. In this case, even if you try to open your eyes really wide, the strength is not delivered to the eyelid, interrupting eyes to open wide, which makes eyelids to look droopy. Patients over middle ages have drooping eyelids which make their eyes look smaller, or people who have trouble due to eyelids blocking the sight. Also, people who have insecurities because of their tired-looking face, upper blepharoplasty would be a big help. Also, young people who have insecurities of their droopy eyes, or people with small eyes are recommended as well. It can be separated as two, design before the surgery and the surgery. These are the two factors. Design before the surgery is the patient's desirable size of the double eyelid, the size of their eyes, are the factors of the planning stage. Even if it's similar shapes, the amount of removed skin, the height of the double eyelid, frame of the skeleton, personal skin depth, leads to different methods for the surgery. The surgery includes removing the skin, making double eyelids. Opening the eyes widely to check the shape of the eye are processed during the general anesthesia. Final procedure is delicate stitching up. If needed, taping is done near the eyelid. The recovery time varies depending on people with their bruises and swelling. For the upper blepharoplasty, the patient needs to visit the hospital the next day after the surgery. For the surgical dressing, stitches are removed on the 5th to 7th days. Before removing the stitches, applying ointment to the surgical sites are only care that is needed. Washing face, hair, and other minor splashing of water are fine. On the 3rd day after the surgery, it is most swollen. Stay away from doing exercises and other physical activities. We recommend just resting. At our hospital, for a fast recovery, we use Light LED treatment to reduce the swelling and heal the surgical site. Make sure to tell the doctor if you have any uncomfortable parts and tell them which part you think is important. Please consider it for enough time. You can also bring photos for examples. The next important part is controlling the right amount of medicine. High blood pressure, diabetes, thyroid disease, etc. Please tell the doctor for your personal disorders. And if you're taking any medication or supplements, taking the right amount of medicine needs to be discussed before the surgery. Normally, medicines for high blood pressure and diabetes are allowed until the morning of the surgery day. Even on the fasting, it can be dosed with a small amount of water. Omega-3, vitamins, ginseng, and other supplements are not required 2 weeks before the surgery day. Aspirin and other warfarin medications for the blood circulation need to be asked if it's okay to be dosed or not. Normally, swelling, bruising, and other side effects for upper blepharoplasty are low correction, overcorrection, and asymmetry. But first, the most common side effects. There may be mild swelling or bruising, but excessive swelling and/or bruising makes it difficult to access time of recovery, as well as increase the length of recovery. In order to prevent such symptoms, we perform delicate surgery and meticulous hemostasis, but along my efforts, it's best managed when the efforts of the patient is present as well. Patients should stop taking dietary supplements before surgery and be at their optimal physical state by stopping drinking and smoking. After surgery, it's important to limit activities that increase blood pressure for about a week. The characteristics of upper blepharoplasty side effects are remaining sagginess due to the lack of skin removal or discomfort due to over-removal of the skin. These symptoms can be prevented through precise pre-surgery design. Aside from the amount of skin to be removed, there are many other variables involved, making long experiences and know-hows are crucial to the surgery. Asymmetry should also try to be prevented as a side effect, but there are many cases where left and right facial structures are very different. So it's important to check and consult these cases before surgery. Before deciding to undergo the surgery and visiting the hospital, many patients go through a lot of thought and decision-making. We try to make our patients as comfortable as possible for consultation as well as surgery. We look forward to seeing you at our hospital. This was Dr. Jeong from Sketch Plastic Surgery. Thank you.